Welcome everybody. It's 12:58 p.m. We'll wait a couple more minutes for the attendees that are still signing on, and then we'll start at 1 p.m. sharp. Okay, let's get started. Welcome everybody. My name is Pascal and I'm a Knowledge Translation Officer at the Heart Institute. I will be your moderator for today's session. I want to start by thanking everybody for attending today's session, things to consider while awaiting coronary artery bypass surgery and what to expect after your surgery. We encourage you to join us every Friday from 1 p.m. to 2 p.m. Eastern Time, where we are inviting different speakers to address current and pressing topics for patients, their caregivers, and our community at large. I'd like to go on a few housekeeping notes before we get started. First, I'd like to inform you that we have muted all participants and turned off video sharing capabilities in order to minimize disruption. We'd like to ask you to please use the chat function to notify presenters and moderators of technical difficulties only. If you have a question at any point during the webinar, we welcome you to type it in the Q&A section. You'll find the Q&A button located in the black bar at the bottom of your Zoom window. We will be monitoring the questions that are coming in, and we'll reserve some time at the end of the session to address as many as we can. We'd like to note, though, that due to the nature of this public platform, we ask that your questions be general in nature. If you have a more personal question, we'd like to encourage you to contact your healthcare provider for a personalized answer. We'd like to also let you know that there will be some live polling throughout this webinar. So when we launch the polls, a window will pop up on your screen with the question and the answer choices. You'll have about 30 seconds to answer these polls, and answering them are fully optional and anonymous. As many of you may be wondering, this session is being recorded. We will be uploading the recording on our website after the session, so please visit our website early next week to view it. Finally, there will be a short follow-up survey that will pop up on your browser after the webinar. We'd like to encourage you to fill it because we take your feedback seriously and use your comments to improve the educational experiences that we offer. We will also be sending the survey by email in case it doesn't show up in your browser. So without further ado, I would like to introduce today's presenters. First, we have Amy Charlebois, who's an advanced practice nurse for cardiac surgery at the Heart Institute, where she provides expertise in patient education, care, and research. Then we have Kim Twyman, who is a diabetes nurse specialist at the Heart Institute and is responsible for the development and maintenance of an integrated diabetes management initiative at the Heart Institute. And finally, we have Dr. Marc Ruel, who is the division head of cardiac surgery and an endowed chair of cardiac surgery research at the University of Ottawa Heart Institute. So I'd like to hand it over to the first presenter, Amy, to start the presentation. Amy.
Hi, everyone. My name is Amy. It's very nice to see all of you tuning in today to our presentation. Today we're going to be talking about things to consider while awaiting for coronary artery bypass surgery and what to expect after your surgery. So it's just some general information for some of you who are interested in this topic out there. So the very first thing that we wanted to touch base on with everything going on with COVID, one of the key messages that we really want everyone to listen to is to make sure that if you're having heart symptoms or angina while you're waiting to have your bypass surgery, do not ignore your symptoms. This is one of the most important things that you can do. So we're going to talk about that shortly, what symptoms would be an emergency and what to do if you're just noticing that you're having an increase in symptoms. The next topic that we're going to talk about is some things that you can do to prepare before your surgery at home to make sure that you're in the best shape and to actually heal even better after your surgery. Kim is going to talk about diabetes, why it's also important before and after your surgery. And Dr. Ruel is going to talk about surgery options and the technique and give you a little bit more explanation about that part. And then together we'll talk about recovery, general recovery after surgery, and we'll have a Q&A after that. So as I said before, do not ignore your heart symptoms. Common symptoms of a heart attack include chest pain, difficulty breathing, discomfort in your chest, arms, back, neck, shoulder, or jaw. If you think you're having a heart attack, then you call 911. So at the Heart Institute, if somebody has coronary artery disease and they're waiting for a coronary artery bypass graft surgery, it's really important, like I said, to listen to your symptoms. So if you are having symptoms and they're relieved with rest, or they're relieved before your second set of nitro, and you just notice that they're happening more often, then that's something you would really want to call us about and let us know about while you're waiting at home. As you can see here, we have a little tool for you to use. When you're in the green zone, your symptoms are under control. Okay, you keep on taking your medications and continue with your heart healthy lifestyle. If something were to change and you go into the yellow zone, so you notice that you're having more heart symptoms with activity, your medications are getting low, or you're having some difficulty with your life changes, then that's something you can contact us about and we can help you out with. If you notice you're having unrelieved angina or heart symptoms, very short of breath, feeling unwell, sweaty, nausea, anything like that, then that means you need to make sure that you're going to call 911. So a lot of people don't know, or they're not really sure maybe when would you call 911. So Lisa, would you be able to put my poll question up today so we can see if the audience can answer that for us? So if you are having heart symptoms or angina at rest, after how many nitro sprays or tablet without relief would you then call 911? A, none, it's relieved immediately with rest. B, 1 spray or tablet with no relief after 5 minutes. C, 2 sprays or tablet with no relief after 5 minutes. Or D, none of the above. So we'll give you guys a couple seconds to answer that poll. I do have the answer up on the display, but just making sure if everybody knows what to do. All right, so we've got our answers. So nobody said none, so that's fantastic. About 20% of people said if you have Heart symptoms or angina at rest after one spray or tablet with no relief of nitro after 5 minutes. 20% said that they would call 911. 60% said that they would call 911 after 2 sprays or a nitro tablet with no relief after 5 minutes. 20% said none of the above. So 60% is correct. That's when you would call 911. That is something that you need to listen to. All right. So how can you and your loved one prepare for cardiac surgery at home? So things that you can do to kind of have the best success and have some pre-surgery conditioning, we could call it, is simply eating good food, okay? Eating good nutrition, protein, it actually helps your tissue heal better after surgery, and it's so important. So one thing, if you noticed at home that you were maybe not eating enough calories, or maybe in the last month or so, you've lost some weight and you're not able to keep that protein level up, that would be something, if you're waiting at home, you could actually contact us here at the Heart Institute for, and we could get you in contact with our dietitian to help you out with that. Another thing you can do while you're waiting at home is plan for someone to stay with you. So after surgery, you know, you're going to be tired, you're going to need some help. So it's really important to have someone prepared to stay with you for most of the day, most of the night, for about 1 to 2 weeks. If you don't have anyone at home, some options is you could maybe ask a friend if they could stay with you for a week or two. There are retirement homes that you can go to temporarily just for until you feel a little bit stronger after your surgery. If you're not sure and you don't have anyone to help you out, you can always call us as well, and we can connect you with our social worker. Another really important thing is exercise. What exercise can you do while you're waiting for surgery? One of the best things you can do is simply walking. So doing walking exercises is so important. Of course, if you have heart symptoms or angina, you want to listen to that. If you know, you're walking and you're noticing that it's making your angina symptoms worse, then that's important to listen. So you would rest and you would call us and let us know. You want to be able to walk and you want to be comfortable. So when you're going for your walks and doing your exercise, you should be able to have a conversation with somebody comfortably. Shouldn't be making you short of breath or feeling unwell. Okay. Practice how to move after your cardiac surgery. So a majority of our patients, Dr. Wuel is going to discuss this later, but a majority of our patients will have an incision in their chest bone here. And we have to be careful of that incision after surgery. So one thing we ask you to do is not to lift, push, or pull more than 5 to 10 pounds for about 6 to 8 weeks to make sure that that bone heals well. So one of the hardest things is just to remember that, because we all, for example, use our hands to push up when we get up out of a chair and those sorts of things. So you could practice at home, not lifting, pushing, or pulling things that are more than about 5 to 10 pounds, and maybe crossing your arms across your chest when you get out of a chair and standing up like this versus going like this, okay? So that's gonna help you prepare as well when you come in for your surgery. We have a waiting for cardiac surgery guide. So you can actually access it on the Heart Institute website, but you'll also get a package in the mail with all of this information in it as well. And that includes all the information about nutrition and exercising and everything as well. My female patients. So my female patients, if they have an incision here in the sternum area, one of the things that we've noticed is that if you wear a comfortable fit front closing bra, it actually can help decrease the pull on the incision area at the bottom. And it also can sometimes help decrease pain after surgery. So it's nice to have one that's comfortable but has enough fit that it's going to help decrease that pull. And the one that does that, the kind that do up in the front, are really great as well. So it's nice to have one of those to bring into the hospital for your surgery as well, so you can put it on after your surgery, and we ask you to wear it most of the day, most of the night. If you smoke, so we want you to quit smoking. Even if you quit smoking, say 3 weeks before your surgery, it actually shows that you'll have a better healing process after surgery. So if you're having trouble or if you need help, call us, let us know. You don't need a referral. You can just call our smoking cessation program at the Heart Institute. Your family can call as well. They can participate as well. And like I said before, any symptoms change, you're gonna call us. So like I said before, I kind of already went over this, the sternal precautions. It's one of the best things you can do to help make sure your incision heals after surgery. We'll practice moving and stuff like that with you in the hospital as well, so don't worry about that part. We're also going to give you this little teddy. Sorry, there's my camera. We call it a teddy, but it's actually just a little pillow, and it actually helps remind you not to use your hands to push up. So you'll get one of these when you come into the hospital before you go home. So I've talked about some of the before surgery things that we can do to prepare. And now I'm going to pass it along to Kim. She's going to talk about diabetes and why it is so important in our population. Thank you, Kim.
Thank you, Amy. I'm not sure why my video is not coming up. I'm hoping
it is up. We can see you.
Oh, good. Okay.
So, well, now you took it down, but if
Oh,
you turn it back on.
Okay, there we go.
We see
Sorry.
No
I'm
problem.
in that speaker view again. Hello, everybody. Thank you for joining us. Amy, can you go back to that, the first slide? I'll just do my polling questions here, Lisa, please. While you're here at the Heart Institute, everybody gets screened for diabetes or pre-diabetes when you walk through the door. And my first polling question this afternoon is, what is the percentage of patients living with diabetes at the Heart Institute? So I'll give you a few seconds. And then there's a second question there as well. What percentage of folks are newly diagnosed with diabetes on admission? So we screen everybody with a test called hemoglobin A1C while you're answering that question. It's a non-fasting test that is often done even before coming in for surgery. If you've come in for an angiogram, we'll do it then. But everybody gets screened because we know how important glucose control is in the outcome, particularly of surgery. So that's why we screen everybody in this building coming in. What kind of answers do we have out there? Oh, we've got some smart folks for sure. So 60% is actually the answer for the first question. So you were tied with the 40. We're pretty high here because you have to remember everybody in this building has heart disease. So we're a bit higher in the Heart Institute than other institutions across the country. And oh, you're really high on the 20% for the newly diagnosed. It's actually just 15. But interestingly enough, the folks that do get diagnosed with diabetes that come in are very poorly controlled. So it's been undiagnosed for a while. I'm going to talk about A1C in a second. And so you can move to the next slide, Amy. Everybody needs to know this before we even talk about the guidelines of where we want your blood sugars to be. So whether you have diabetes or pre-diabetes, even before you know, if you've got impaired glucose or there's insulin resistance going on in your body. And when I talk about insulin resistance, I think of it like a wall. If you're not moving enough, if you're not eating healthy, all of these things contribute to building the wall, as well as stress. Everybody's under a lot of stress right now out there in the community, which can sometimes cause hormones that increase that wall that won't let the insulin do its job properly. So even if you don't know you have diabetes, if you've got any of those risk factors, particularly the genetics, so if somebody in your family has diabetes already, your wall is going to build up faster, which contributes to a lot of glucose circulating in the blood. And so many people know about the long-term complications, but even before you get diagnosed with prediabetes, there's a lot happening in the coronary arteries. Glucose is shown to contribute to the development of plaque and sort of irritates the blood vessels, which contributes to that plaque sticking and being a bit more unstable as well. So don't discount glucose. Everybody thinks of it as something yummy. I think of it more as acid in our body if we've got too much. It does fuel the body. You do need glucose on board, but a healthy amount. Next slide, please. So I talked a little bit about how we diagnose diabetes, that A1C test. And what it is a look back at a healthy hemoglobin molecule that's floating around. The lab isolates that oldest one. It lives for about 120 days, and it measures the amount of glucose that has stuck to it during that period of time. If it's between 6 and 6.4, you're considered to be somebody with prediabetes. And if you're 6.5 or above, you're considered to be somebody living with diabetes now. The good news about being diagnosed early and knowing that you have prediabetes is there's a good chance that you can decrease the progression of going on to develop diabetes by just losing a little bit of weight, 5% of your body mass, continuing to keep that weight off, and eating healthy and moving is really important to help maintain that weight and keeping diabetes at bay. Next slide, please. So these are the targets. You'll see the normal range. So if you don't have diabetes, that's where your blood sugars should be sitting in the normal range. For those of you who are out there waiting for surgery, we really want your blood sugars to be at target. Again, to promote healing and decrease that risk of infection. I have many folks who say to me, I don't feel good when my blood sugar's in that 4 to 7 range, but it is so important that we get you there while you're waiting for surgery and after surgery. So if you're not at target, that A1C has to be less than 7% ideally. Please reach out to your team. And if you don't have a team, a diabetes team in the community, please reach out to myself or my team here at the Heart Institute, and we'll get you sorted out before surgery and make sure we get those sugars down. Next slide, please. So unfortunately, that's what takes people with diabetes is heart disease. It's 2 to 4-fold. It's the leading cause of death for folks living with diabetes. And the problem is it often happens at a younger age. People are having silent heart attacks at home. Even right now, people are very fearful of coming into the hospital and are leaving it to the last minute when they start to have that shortness of breath. People with diabetes don't often have those classic symptoms that we talk about. So it's really important for you to be screened annually by your doctor for coronary artery disease. They usually do an ECG. The extent of the disease is often worse in people with diabetes. It's further on in the blood vessels, which makes it difficult to put those stents in. And often you don't have as good outcomes after surgery. So the sooner we know and get that blood sugar under control, the better. Next slide, please. So I know this is a busy slide. It goes back to pathophysiology days. If you think back, there are so many organs that control the amount of glucose that's in our blood. And I just wanted to put this slide up because the next slide we're going to talk about medications. And the medications address all of these areas where glucose is regulated. So we can move to the next slide, Amy. So our number one drug, once you know you have diabetes, and often in prediabetes, metformin is used as well. It really does help with that insulin resistance that I was talking about. It takes down that wall, and it also keeps your liver quiet from dumping out too much sugar during stressful periods of time, or if you go too long between meals. So metformin, it's an old lad, it's been around for a long time, very safe. If you've tried it before and had problems with GI issues, I would encourage you to still try again. Make sure you take it with food. Try a smaller dose. We really want you to be on this medication. The next drugs that I wanted to talk about are the SGLT2s. You can see it there beside the kidneys. This is a new family of drugs. New meaning the last 5 years in Canada. It's probably even now 7 or 8. Time flies by so quickly. But this class of drugs has shown to be very beneficial for people with heart disease. So it decreases your risk of coronary artery disease, decreases the progression of heart failure, lowers your blood glucose, protects your kidney. It just sounds all too good to be true, but it really does work. People lose a little bit of weight on this drug and often don't require as many of the other medications. So don't be surprised if you're on each one of these drugs, each class working at different parts of the body. It really is important to take all of these drugs if they've been prescribed for you, because they really do work at different areas to control your glucose, to bring it down. Next slide, please, Amy. Oh, this is my last slide. So these are the education resources out there in the community. Here at TOH, we actually have a special course designed just for people with prediabetes, and I would really encourage you to go to that. Of course, it's all online right now virtually, and the same with the community diabetes program. They're all over the city and in the outlying areas. Free parking if things lift up, they might be able to see you individually. At this point, they're seeing people virtually just like this. I just wanted to say one more thing before, Amy, can you go back to the medication list? I'm missing one slide, I just realized. We really want you to know that a lot of people in this building do require insulin. It's not the bad guy. Over time, the pancreas does get tired and you do require, there's the slide, thank you. They often do require insulin. And so don't be surprised if you do need insulin while you're here post-operatively, or even during the surgery period, we may need to start some insulin. It's so important to keep your blood sugars under control during surgery, before surgery, after surgery. And if it takes insulin to do that, we're going to use it. But surprisingly, once people start healing and start moving again and start eating, often insulin can be discontinued. So it's not necessarily for life. It could be just during this period of time when you're under a lot of stress, and it's so important to get those blood sugars under control. So thank you. I'll pass the torch to Dr. Ruel.
Good afternoon, everybody. Mark Ruel here. Thank you for joining us on this webinar. I want to thank Pascal and Amy and Kim for excellent presentations and a great introduction. I think it's good to have you here because what is being discussed is so tremendously important. Many of you may be concerned by diabetes, its impact on the heart, or maybe worried about yourself or a loved one who has undergone or may undergo surgery. And I think, you know, what you've heard today is helpful because it separates the number of things that can be done to improve the outcome after surgery. And I like to think of heart surgery as first a real lifesaver. There's no doubt that there's not too many surgeries that can be performed that save as many lives as heart surgery does. And that is because, you know, it's a very powerful concept to go around the heart and produce new arteries. Every human being is born with 3 arteries around the heart, but usually we perform an operation if all 3 of these are affected, sometimes 2, depending on the exact presentation, and sometimes the main artery feeding two of those arteries can also be affected and lead to a need for an operation. So you can see here what bypass surgery is about. Essentially, we create new arteries. The blue thing that you see here on the left-hand side is a vein taken from the leg, which is inverted and becomes an artery because of the way that we've positioned it. And we carefully craft connections between the existing artery and a new blood supply, in this case from the aorta. And the one you see on the right-hand side, you can see this artery coming from the subclavian artery at the top, essentially shows you how you can use an artery from the chest wall. This one is called the left internal mammary artery, and use that to bypass the artery at the front here called the left anterior descending artery. And that bypass is very, very good. We call it the line of life, if you will. And it's a very important bypass to maintain patients alive. Next slide, please. So essentially, what we're talking about today is a little bit about the surgery itself, but so much more about what you can do to prepare for surgery and enhance your recovery afterwards. A few words about the surgery. Essentially, there's two types of incision. By far, the most commonly used incision is the one that you see on the left-hand side, the traditional or hard bypass incision, sternotomy incision, what people call incising the breastbone. On the right, you can see an alternative incision that we use in Ottawa at our center probably maybe up to 10% of the time, depending on circumstances. We can do valve surgery through this incision, and we can do bypass surgery, one or several bypasses. It's not for everybody. We often have patients asking whether they could have their surgery performed this way, and we certainly consider it for everybody. But the reality is that you have, I'll be very explicit in saying the incision is so small that you can't even get your hands in there. So you have to work with long instruments, and if the patient was to be in a more unstable situation, or the heart is weak, or some other factors that may require that you actually put your hands in there and be able to massage the heart and do specific procedures to the heart, well, that incision is too small. My hand, as you can see here, doesn't fit into a 4-centimeter incision. And that is true of any surgeon. So the minimal invasive heart bypass incision is wonderful. We think that it enhances recovery. But what matters first and foremost is the result of the operation and whether the operation was safe and effective. I often like to compare heart surgery to airline business, if you will, and certainly not airline business now, but airline business prior to COVID. And I say there's always 3 priorities. And the first one is the safety, a little bit like when you take a plane. The second one is the efficacy of the operation. So if you're flying to go to Calgary, but they're a bit concerned about one of the 2 engines, they will land in Winnipeg. And that may not be efficacious in getting you there, but at least it was safe, first and foremost is that. And third, and we certainly know that airlines are not great at that, the third priority is comfort. So comfort would be the approach, the incision, if you will, the ability to do it through a small incision or a conventional incision. And if you have a small incision, the recovery will be faster, but you have to make sure if you do that, that you don't compromise safety and efficacy of the operation. And that's the principles that we have espoused all along as we developed several of those surgeries. So the surgery is very safe. In general, at the Heart Institute, we have excellent outcomes. There's obviously situations where the outcome may not be what we have hoped for, but these are few and far between, fortunately, and our results get better year after year as technology develops. The surgery itself will, I'll take an example of a regular valve surgery or bypass surgery, will appear to the family of the patient to take between 4 and 6 hours. The actual surgery time is more akin to 3 hours. It can be between 2 and 4.5 hours, but the overall experience appears longer to the family awaiting results of the surgery and news because of the time for anesthesia before and preparation, etc. Also, at the end, the surgeon has to make sure that the patient's okay, stable enough, and only then will he or she in the future, because we don't yet have female surgeons in Ottawa, but we certainly hope to bring them soon, and we've identified very top individuals to fill that mandate, which is very important to me. But this being said, once the surgery is complete, then the surgeon would meet with the family and give news around the surgery. So that's the surgery part itself. And surgery, as I said, is generally very, very safe, especially if a patient is stabilized prior to surgery, comes from home, and we're not operating in very dire, very emergency situations. Now, once the surgery is finished, there's essentially something else that starts, and it's the recovery portion for the patient. So the recovery, I would call it the immediate recovery, which is typically performed in the intensive care unit, where the patient may be asleep some of the time, then wakes up and recovers acutely from the surgery, starts eating a little bit again, getting dangled, standing up. And once that's complete, then the patient goes to the ward. And that is the beginning of what I call the more prolonged recovery. So ward care, moving towards getting back to the home setting. And I think there are things, as Amy and Kim were denoting, that can be done to enhance that very much. So smoking cessation, for example, would help in the ICU, would help with the lungs, would help with regards to having a clean chest and being able to have good respiratory efforts after the surgery. It also diminishes, believe it or not, the risk of infection of incisions and of the surgical approach. Glucose control, as Kim was alluding to, is tremendously important. Amy talked about preparing yourself for surgery, both from a nutritional point of view and also from a mobilization point of view. So from a nutrition, you can really ensure that I usually tell my patients to make sure that they eat a good amount of protein at least once a day. So I say fish, chicken, or meat at least once a day, because you need those immunoglobulins, you need that albumin to be present. And as people age, many North Americans actually are not so fulfilled with protein intake as they should be. So that becomes even more important before open heart surgery, so that your immune defenses are as high as they can be. In the same token, Amy was talking about very interesting exercises, which I completely agree with. I usually, if someone's waiting for surgery and they want to do something to help out, I give them a little bit of an assignment to practice getting out from a chair or getting out of bed without using their arms. And they find that often patients find that difficult to do. And unfortunately, my response to them is that it'll be even more difficult after surgery. So it's a great time to tap into that opportunity and practice doing that. So these are essentially the few things that I wanted to add to what I believe were two excellent presentations by Amy and Kim, who are extremely experienced and such central parts of our team after surgery. You'll spend, if some of you or your loved one needs to undergo surgery, a lot of your care will be very revolving around our nurses, either advanced practice nurses or your bedside nurses or ICU nurses or even operating room nurses. I often say that, you know, the surgeon, once the operation's over, I'll see a patient 5-10 minutes per day, but the nurse will spend 23 hours and 50 minutes with the patient. So that is really important. And thank you again for your attention today, and we'd be happy to take any question that you have.
Great, thank you, Dr. Rao. So I'd like to invite the other two panelists or presenters to come back for questions. And I'd like to remind the audience that if you have a question, please type it in the Q&A section at the bottom of the Zoom window. You'll find the button there. So one of our questions is for Amy. You talked about some exercise to do before and after, and somebody's asking if there's one best exercise to do after coronary bypass surgery, and if so, what is it?
Absolutely. So that's a really, really great question. So on top of when you're in the hospital after your surgery, so the nurses are going to work with our patients, show them how to move with our sternal precautions, but we also have amazing physiotherapists. And so all of our patients will receive a recovering from cardiac surgery book before they go home. And we actually will give you an exercise program to do every day at home. And one of the basic things, one of the best exercises we can do is walking exercises. So we'll ask our patients to walk at least 2 times a day. And then we usually get them to increase the length of time of the walk by at least 1 minute every day as they get stronger. So, and we'll practice that with them when they're here in the hospital. But walking is one of the best things you can do. And then one of the other exercises would be actually exercises for your lungs. So what we ask our patients to do after surgery, because after surgery, sometimes at the bottom of your lungs, they can kind of stick together a little bit, and we want to open them back up. And if there's any mucus or anything in there, we want to help get it out. So what we get our patients to do if they have a sternum incision here, you cross your arm to protect your sternum. You take a big deep breath in through your nose, out through your mouth. So you'll do about 10 big deep breaths and then 2 little baby coughs every hour when you remember, when you're not asleep, for the first 4 weeks or so after your surgery. And it just helps open up your lungs. So there's the walking physio exercises that you do, and then there's the lung exercises that we do as well. And like Dr. Ruel said, one of the most important things you can do after surgery, even after you've been discharged home, is to eat really good food. Some of our patients after surgery, they're not that hungry. Their appetite's down a little bit from all the medication, maybe not moving around as much. But even if you're not hungry, you need to eat. You need to eat lots of good protein, lots of vegetables, lots of good food like that. It helps decrease your risk for an infection. It helps you feel better, okay? So that's going to be really, really, really important. Some of our patients are like, I don't feel like eating 3 big meals a day. It's too much. If that's the case, maybe try to eat 5 to 6 smaller meals throughout the day, but make sure it's the good food with lots of protein. And like Kim touched on, I'm sure she'll touch on it as well. Another really, really important thing is after surgery is not to ignore higher blood sugars at home or low ones, but if you have higher blood sugars at home after your surgery, that's something you would call us about and let us know, because sometimes the stress from the surgery can make your sugars, I call it, kind of go out of whack, and you need a little bit of help, and that's okay. So it's something we don't want you to ignore. When your blood sugars are high, the blood in your body is kind of like maple syrup. It's slow, it's sticky. When it's balanced, it's like water out of a tap. So it moves nice and smooth, and that's what we want. That was a long answer.
Great, thanks, Amy. No, that was very informational and helpful. Our next question is for Kim, where somebody is asking, can heart surgery reverse diabetes?
Oh, no, not yet. I don't think that will ever happen. So diabetes is all about insulin and pancreas and the cells and how they use the fuel. So no benefit from curing diabetes. Sorry.
Great, thank you. So one of our attendees is asking, what do I do if I get an infection? So
if anybody, so what we do at the Heart Institute, we actually have tools for you to follow. So if you're at home and you notice that you look at your incision and, hey, it looks a little bit more red, or it looks a little bit worse than when I left the hospital, then what we ask you to do is right away you call us. So Monday to Friday, you can call your surgeon's office if you like. But there's always also the nursing coordinator number. It's a contact that we have. It's 24/7. So you can always contact us. And it's very important that if you thought that there was any signs and symptoms of an infection, that you don't wait a couple days. You don't try and fix it yourself. You know, that's something you definitely don't ignore. You let us know right away, and then we'll help you out. Even if you live 2 hours away, or with all of the stuff going on with COVID, it's very, very important for you not to ignore those symptoms.
Great, thanks, Amy. So
I would add, I think what Amy has stated is very true. It's also, even if the incision is shown to another healthcare practitioner, I usually find that there's usefulness in us hearing about it.
Mhm.
Because not everyone may be very facile with dealing with breastbone incisions. And frankly, they are a bit more sensitive than other types of incisions. It's a bit different than an incision after a cesarean section because the heart is just under, the lungs are there. So a lot of things can actually be in jeopardy if the infection is not treated according to the very best care. So I would say we've seen examples where everyone was well-intentioned. The incision had been shown to a physician in a convalescent home or something like that, and then an infection was missed. So it's good if we hear about it and are able to relay it to the surgeon's office in all instances.
Great, thanks, Amy and Dr. Rao. This is another question for the two of you. How long is a typical recovery after heart surgery?
So that's a very good question. So one thing is just to touch on, so the hospital stay part, usually you're in the ICU, the surgery ICU after your surgery, you'll be there for about 1 day to 2 days. Again, this is ballpark, just to give you an idea. And then usually you're in hospital for about 4 to 6 days, and then you go home. Now, sometimes, you know, I've had patients before where they think they're going to get better after 2 weeks after having heart surgery, and they feel like they should be able to get back to doing what they were doing, you know, years before, these types of things. It's very important to note that it takes about 2 to 3 months to really get all of your energy back after having a heart surgery. So you have to be patient, and you know, it doesn't go from 0 to 100, but you'll get a little bit better every day as you do your exercises and eat well and do all of these things. But it's important to be patient and to know that it can take up to 2 to 3 months to really get all of your energy back. And some people, it can take even longer. You know, I've heard of people who maybe before surgery, they weren't as active because of their heart symptoms. So they decreased some of their muscle mass before surgery. And then, you know, they got stronger, but it took them a little bit longer, maybe 5 months or something. And then they were even better than they were before surgery. So it is individualized, but basically it's about 2 to 3 months, I would say.
Yeah, I would add to everything that Amy has said, which is completely accurate. Heart surgery is a bit of an investment in the future, if you will. It's not a short-term fix. It will fix the problem, obviously, for the near future, but there's a price to pay with regards to invasiveness. And 2-3 months is probably the average recovery. It really depends how you define recovery. To be able to drive a car, for instance, if you're recovering normally after surgery, oscillates between 3 and 6 weeks. To be able to go out to the restaurant for dinner, maybe 6 weeks from the time of surgery. To forget completely that a patient has had surgery and you know, completely go without anything ever having been done may take 6 months, 9 months. It may take a little longer. So I would completely agree with what Amy just related.
Great, thank you so much. Our next question is for Kim, where somebody's asking, why is it noted next to SGLT2 that not insulin dependent?
Right, so this new class of drugs works at the kidney to, if your kidney is working properly, it doesn't let glucose escape into your urine. So what this drug does is it opens up those doors so that some glucose goes in. So it's not impacted by insulin. Normally it's insulin that controls how much sugar is taken up into the body. But in this situation with the kidney, this drug is opening up the gates so more glucose will go into the urine. Has nothing to do with insulin.
Great, thank you so much. So we have time for one more question. So somebody's asking if you just had coronary heart disease, surgery, what are the signs that you should be reporting to your doctor immediately after? Like if there's, if there's signs that are negative or that are alarming, which ones are the ones that you should be reporting immediately to your doctor and your surgeon?
For sure. So one thing, after you're discharged home after your surgery, one thing that you would do is if you ever thought something was an emergency, obviously you have to call 911. But if something is not an emergency, but it's something that is worse than when you left the hospital. So example, if you're feeling a little bit more short of breath than when you left the hospital, that would be something you would call about. Again, like we had talked about before, if you had any signs and symptoms of an infection, that would be something you would call us about right away as well. Like Dr. Ruel said, we're very protective over our patients, and we would want to know if there's something going on there. And also, I have all of the information in our recovery book. So it tells you very clearly some examples of things that would be an example of an emergency and examples of things that you would call us for. So really my basic comment is if somebody left the hospital, was discharged home, and they feel like something is different or worse than when they left the hospital, that's something you would call us for.
And I just want to add, if your blood glucose is consistently above 7, please call.
Yeah.
That is very important. Two great points, actually, both Amy and Kim. And the other thing I would add is not uncommonly, patients call because they're not sure about the chest pain that they're having, right? Many patients come to operation, the very first symptom that they had that led to an angiogram and subsequent bypass surgery is not uncommonly because they had chest pain during exercise, or even sometimes not during exercise, and they were having some form of a heart attack. So patients often get confused, am I having, and it's really very hard to know for sure. So we encourage is it the incision, to ask around, whether the incision is perhaps causing the pain, or is there another issue with the heart that may be recurrent. And I think there's a number of things that we use around that. Is the pain brought on by activity? Is the pain reproduced by pressure? Is it dull? Is it felt to be waxing and waning in the incision, as opposed to being deep inside and going to the arms, etc.
Emergency resuscitation.
So it's unusual. Most patients after bypass surgery, for instance, would be free from angina. So most of the time it is coming from the incision, and there's a little bit of what I call healing pains. People will feel jabs of watching TV or resting and doing something with their spouse, and suddenly there's a sharp pain that comes up. So typically these are very benign pains, and they're part of healing, if you will. So, but not uncommonly do we get questions around the types of pain that are experienced after surgery.
And I would just like to touch on that too. I notice a lot of times with my patients after surgery, we'll be doing some education. And one of the things that's very important is I've heard people say, oh, I've had a bypass surgery now, so I'm cured, So our surgeons are amazing. And yes, now your arteries are flowing well and all of that. But it's very, very important to remember that even if you've had a bypass surgery, you still have coronary artery disease. So it's so important in your future to still be thinking of that prevention piece. So you want to continue even after your surgery, even 5 years from now after your surgery, to make sure your blood sugars are balanced. Make sure if you have high blood pressure that it's getting managed and we're trying to balance it. That you listen to your body. Say 5 or 10 years from now or 20 years, you think you're having chest pain or new angina pain, that you go to your doctor and you go get that checked out. That's so important. And then another point that I usually always bring up too is sometimes people don't think about it as often as genetics. So genetics is a big thing to think about as a risk factor. So, you know, sometimes I'll be talking to a patient and they're like, you know, my dad had a heart attack at a young age. My brother had a heart attack at a young age. I've had a heart attack at a young age. And I usually say, well, do you have any other siblings? Do you have sisters? You know, they should be getting checked out by their family doctors and being screened for coronary artery disease as well. That's something that people forget. That's a risk factor sometimes. And then all of the things that we said before, again, like avoiding excessive alcohol, avoid smoking, you know, doing our exercise, still eating well, these things that are really good for us.
Wonderful.
Great
Thank
points.
you.
Thank you.
Thank you, Amy. Thank you, Dr. Rell. So that's all the time we have today for questions. I'd like to thank everybody who attended the session, and I'd like to thank Amy, Kim, and Dr. Rell for taking the time to share this important information with us. Before we end the webinar, I'd like to remind everybody to please fill out the feedback survey that you'll be getting either by email or that will be popping up in your browser once we end this webinar. I'd also like to point you to pwc.ottawaheart.ca for more information on upcoming patient webinars that take place every Friday from 1 p.m. to 2 p.m. Eastern Time. Also, if you have a question that you really wanted answered and that wasn't answered, I'd like to invite you to email us at pwc@ottawaheart.ca, and we'll forward it to the right person and get an answer to you as soon as possible. And lastly, as it's been mentioned many times throughout this webinar, if you have need of urgent medical attention, either you or your loved one, please don't hesitate to go to hospitals or emergency departments. They've taken additional measures to ensure the safety of the patients, so please don't ignore your heart symptoms and don't be afraid to seek urgent help. That's it for today, and I'd like to wish everybody a wonderful afternoon.
Thank
Thank
you,
you, Pascal. Thank you, everybody.
Bye, everyone.
Kim, thank you, Amy, and thank you, everyone, for attending our webinar. It's been a pleasure.
Bye.